We have done our sodium reabsorption and glucose reabsorption. Now coming to the reabsorption of water. I told you one fact, whether with the presence of ADH or without the ADH, water reabsorption is maximum at the level of PCT. Don't get biased with the question saying that in the presence of ADH. They confuse you people like that only. So in the PCT, already 2/3 of water is being reabsorbed. 60 to 70% is reabsorbed in the PCT. And water channels, what is the name of water channels? They are called as aquaporins. Aquaporins, because aqua itself is a water. It will be like inserting the aquaporins inside that. So coming to this, the type is here is the in the PCT is aquaporin type 1. Whenever we talk about DCT and CT, they will do water reabsorption in the presence of ADH, and they do very little only, 10 to 15% only. And the aquaporins are different for an apical side and from a basolateral side. Basolateral side. The aquaporin on the apical side is we are done with our one. In the PCT, we had aquaporin 1. Now just we have to remember 2, 3, 4. It is in the order only. In the DCT, on the apical side, we have aquaporin 2. Whereas on the basolateral side, we have aquaporin 2 and 3. So these are the aquaporins. And there are some facts about sodium reabsorption which we have to remember, because it is different for a low potassium diet and a person is taking high proteins, that is high potassium diet. What happens is the PCT is reabsorbing 80%, that we saw. PCT will reabsorb 80% in the high diet also. Then the thick ascending limb, they will reabsorb 10%. They will also reabsorb 10% here in high diet also. The difference comes in this DCT, whenever the person is under low diet, it reabsorbs. It reabsorbs the potassium 8% and remaining sent in the urine. Whereas this DCT, whenever the person is under high potassium diet, it doesn't reabsorb. Instead, it secretes, because potassium too much in the blood levels will cause severe arrhythmias, which we don't want. Kidney is a wonderful organ to prevent this arrhythmias, wherein 20 to 180% of the normal reabsorption can be secreted in and sent out in the urine. That is one beautiful thing about this potassium levels. So this potassium levels, whenever it goes beyond a level, it is very dangerous for the person. That's why it should be prevented.